All right. Hi. Welcome to my final assignment for Counseling 201 Research Methods. This is just putting it all together. We did a lot of work this semester with research and interviewing other counselors and collecting secondary data for the state of Iowa. Um, I researched a certification program called trauma-focused cognitive behavioral therapy, and that will be the focus for most of this um, presentation. First things first, we talked about what our future plans are. So for me, um, 10 years from now, my goal is to be working in a private practice setting, serving young adults with various mental health concerns. Ideally, I'll be working with young adults and adults over the age of 13, navigating various life challenges. I'm especially interested in serving the LGBTQ community and individuals with chronic illness, as that is the population I've been working with for the past year at the project. I anticipate to continue my career with the project throughout grad school and hopefully afterwards for a couple of years, depending on licensure and who will accept the insurance that LMHCs can use. I want to specialize in trauma-informed counseling and get certified in trauma-focused cognitive behavioral therapy. I feel like trauma is important across all ages, and having expertise in trauma will allow me to serve an array of clients. And stress that trauma doesn't have to be this huge problem, but that everyone experiences like micro traumas throughout their life that oftentimes need to be addressed in therapy. So I think it's definitely a specialty area that is going to be super helpful throughout my career working with an array of clients. Other things I'm interested in working in as a counselor is grief and becoming a certified grief counselor. Loss plays a major role in people coming to therapy. I know that is the reason that I first got a therapist was after the loss of a loved one. So I think it's good to have those skills in your toolbox. I'm also really interested in working with couples. I think that being in a relationship is really hard, and having a therapist can be super, super helpful. But for this assignment, what I focused on the most was trauma-informed care and trauma-focused cognitive behavioral counseling, and getting that certificate program. As I said previously, I think working in trauma is super important, and I think having a trauma-informed background is something every counselor should have, because trauma is a huge deal in society today. So getting the certificate or just being more educated in trauma-informed care is super important. As you can see on my slides here, I do plan on working in private practice, potentially a clinic like Unity Point, but any private practice setting really would be great, because I think that gives you more opportunities to work with different people. Hopefully, and this is just a long-term goal, I would open my own private practice in a rural community, because I think that per our research that we did, there are not a lot of mental health counselors in these rural counties, and being able to provide that service would be super meaningful to me, because I grew up in a rural community. I grew up in a really small town, and I would love to be able to give back and provide a service down there somewhere. And becoming a professor, getting my PhD and becoming a professor is also on my list of future plans. However, I doubt that I will do that in the next 10 years. It'll probably be more in the next 15 or 20 years, but it is something I've always been passionate about, is teaching. And I know that I wouldn't want to teach children or young adults, but teaching an older population is something I'm interested in. So I anticipate within the next 10, 15 years, that is something I'll be working on. Well, what can I learn from Drake while I'm here? Drake has been an awesome experience so far. I've been in the program for about a year and a half now, and I've already gathered a plethora of information about becoming a counselor. Outside of the basic academia and skills, I've learned the importance of networking and collaborating with peers and colleagues. We've performed interviews in both intro to counseling and research methods, and I feel like getting out there and interviewing other professional counselors has been a huge asset. Um, every counselor that I have met has stressed the importance of networking and building those contacts, and that is something that I wouldn't have thought to do before coming to Drake. Um, throughout my time here, I plan to grow and develop essential counseling skills and techniques. I will learn more about people and how to serve them best in the communities that I can serve and the communities that I can't. I can learn about myself and the people who I am capable of helping, along with any limitations that I may have as a counselor. I plan on continuously building my toolbox with skills, techniques, and information in order to become a more effective counselor. Drake offers excellent opportunities for growth and knowledge building opportunities outside of the classroom as well as inside. With my remaining courses, I know I will achieve excellence in counseling skills, knowledge of the profession, and develop precious contacts throughout the state of Iowa. Being at Drake has already led me to a position on the Iowa Mental Health Counselors Association board as a student representative, which has been an excellent learning opportunity and has given me a chance to put myself out there and network with other professional counselors in the state. Drake has ultimately already filled my toolbox with skills on how to listen. In classes like Methods and Psych Disorders, we have learned a lot about the brain and how to assist individuals get from their left brain to the right brain and back. And all of these amazing things that I had never learned before. I've learned how to read people's body language and facial cues in a way that I never have before. I plan on continuing to add to the toolbox in the next year with classes like group procedures, assessment, and positive psychology. All of these classes, I see opportunities to learn from professionals who have great experience in the field. During practicum and internship, I get the opportunity to apply all of these skills I have learned to the real world counseling interactions with clients. So I do think Drake is a huge asset, and I plan to continue my education here and continue to grow as a counselor, adding to my capstone portfolio and being able to reflect on everything I've learned so far has been awesome, and I definitely think continuing to do that will be great for me. So the specialized training certificate program that I'm focusing on for this, as I said, is trauma-informed therapy, specifically the trauma-focused cognitive behavioral therapy certification program. So what is trauma-focused cognitive behavioral therapy? And I'll refer to it as TFCBT throughout the rest of the presentation. So it's structured and short-term treatment that improves trauma-related outcomes. When it was developed, it's been directed towards improving trauma in youth. It also encompasses teaching skills for the caregiver to have supportive interactions with the affected client. So the counselor works with both the child and the caregiver. And this is why I'm super interested in it, is because though I have more of an interest in working with adults, I think it's a great opportunity to work with both adults and children. I definitely put a larger focus on working with the caregiver, as I think that they play a huge role in the child recovering adequately. So it's an evidence-based practice that was developed to help children recover from trauma. However, aimed at youth, the skills learned in the certification program can be used to serve the adult populations as well. The strategies behind TFCBT align very well with my personal belief system and my theoretical orientation because it's directed and concrete and goal-oriented, which is kind of how my brain works, is short-term goal-oriented counseling. It's directed at improving trauma in youth, but it also encompasses teaching skills for caregivers, as I said. This gives me a chance to work with both adults and adolescents, which is awesome. For whom is it appropriate? So personally, and I believe it's appropriate for all ages, though specifically developed for children. I think that it's definitely going to be effective and useful and beneficial for working with adults as well. It meets the diversity standard. The studies have proven that it is effective across all cultures, and it is being utilized not only in the US, but in Europe and Africa as well, which I think proves its effectiveness. Um, According to the website, it's being used in the US, Africa, and Europe. So I think that's really awesome. Um, it's been tested in several completed and ongoing studies for children ages 3 to 17. Um, the children have experienced anything from sexual abuse, traumatic grief, domestic violence, terrorism, disasters, other multiple traumatic events. Um, I think it's going to be great for the use in Iowa as well. I think most people in Iowa are going to be hesitant to go into therapy on their own, but if someone has experienced a traumatic event, they're going to be more likely to reach out to a therapist. And I think that's especially true in the state of Iowa, where counseling still has a big stigma that follows it. So I think being a trauma focused cognitive behavioral therapist and having that certification is going to get more people into your door for sure, because I think they're going to see that and they're going to say, this is why I'm coming to counseling, is because something happened to me and I need it. So looking at the statistics that we brought together for the state of Iowa, I think there are a lot of children who will benefit from it. I mean, the stats show there are a lot of children living in lower income situations, and the possibility for trauma for those living in lower income situations is a lot higher. And so they will benefit more from having this kind of therapy. So I found a couple of really great studies about TFCBT. Just a quick overview of it. It was developed by 3 doctors, Anthony Mariano, Judith Coun, and Esther Deblinger. Over the past 25 years, it's been evaluated and refined. So it's changing and growing with the change of population, which I think is great. Proven to be extremely effective to help individuals recover after experiencing a trauma. Currently, there are over 14 randomized controlled trials that have been conducted in the US, Europe, and Africa. All of these studies show that TFCBT is a superior method for improving children's trauma symptoms and responses. I found a really great article by Yazinski about the caregiver's role in trauma-focused TFCBT, which really stood out to me because I want to work with the adults more than the children. I want to focus more on the caregivers. So this study really showed the importance of caregivers' involvement in therapy with the child. Basically, TFCBT is like 3 phases. The first phase is stabilization and skills building, and that encompasses gradual exposure to general trauma cues by initiating discussions about trauma in general. Maybe not specifically this child's trauma, but just trauma in general. Doing this can help minimize parent and child avoidance, help grow coping skills, so working on relaxation techniques, effective expression and modulation, and cognitive coping and restructuring. These are all introduced during this first phase of the therapy to help the caregiver and the child learn relevant behavior management skills, and also the therapist will provide guidance to the caregiver to teach how to respond to what's happening with the child, how to appropriately give feedback to the child, and effective parenting skills with the child who's experienced trauma. So this phase is just kind of the building blocks to the big phase, which is the trauma narration and processing phase. So this is the big kahunas with trauma-focused CBT. This is where the child is going to write out the details of the trauma, or draw a picture for the trauma, or sing a song about the trauma. Some kind of narrative around the trauma is going to be discussed, brought out, written down. Something concrete is going to happen in this phase with the child. So the child's creating their trauma, recreating it, which can be a really big challenge for the therapist, and how to handle that without re-traumatizing the client, how to respond. So I think training and certification is essential in this. And then in this phase, the caregiver is shown whatever the child creates, and the therapist kind of is there to make sure that the parent responds in a positive way and a supportive way for the child. In the study, Uzinski's study showed that parents or caregivers who respond um, in an affirming, positive way um, relate directly to the child having better outcomes, so getting over the trauma. Um, and then the third phase is just kind of a wrap-up phase. It's called integration and consolidation phase, and this is where the parent child are in a conjoint session together, and they share the narrative and talk about, developing safety skills and how to reduce the risk of victimization. And this phase is also super important because it gives the chance for the child and the caregiver to really come together and debrief and move forward, move on, which is super important. So the major results of the Uzinski study, like I kind of already went over, caregiver involvement is highly important, and positive caregiver behaviors during the narrative phase specifically is associated with better child outcomes. Whereas negative caregiver behaviors during this phase were associated with poor maintenance of treatment and child gains. So, I have an example on the next page with different positive outcomes versus. So you can see here, caregiver support, concern, empathy, care. I won't go through all of them. Whereas like blaming the child for what happened. And there's examples of like what to say. So like she was just using the abuse as an excuse for acting out. We're the ones paying for it. She's the problem. So blaming the child obviously is never good, and that obviously is going to lead to issues moving forward with the child. So I thought that was just a good graphic to have explaining how the study was coded. So the difference between caregiver support and blame and good processing and avoidance and child accommodation. So this is just kind of what they used as a way to gauge positive versus negative parental involvement. So moving on with more studies about parental involvement in cognitive behavioral therapy, as we kind of went over, the main goal of PFCBT is to provide children and parents with stress management skills prior to encouraging direct discussion about the traumatic experience. Educating parents is a huge, huge, huge part of trauma-focused CBT, providing the parents with opportunities to learn and enhance effective parenting skills, use of praise, selective attention, affirming words to the client. And so together, the client and the therapist work on relaxation skills to reduce stress in both the child and the caregiver. And this can be anywhere from deep breathing to yoga to playing a game, just depends on the child's age. And then getting effective coping skills. So traumatic exposure can create like a large amount of other issues in a child, PTSD, depression, substance use disorders, and sometimes it won't cause these problems. But one thing I read was that trauma-focused CBT should only be used if the trauma is the existing problem, if that's like the main reason someone came into counseling. So if a child is dealing with depression or substance use, that issue needs to kind of be addressed before CBT will be effective for them. And as I stressed in the last slide, the biggest part of TFCBT is the narrative. So after completion of the skill building components, the therapists move to trauma-specific components. So the child gradually develops the narrative and tells the story. And there's different, like a book, poem, song, other narratives. The purpose of this is to overcome avoidance of traumatic memories, identify cognitive distortions through the child's telling of the story in his or her words, contextualizing the child's traumatic experiences into a larger framework of the child's whole life, telling the story in context. the child is able to see that he or she is more than just the victim of trauma, which I think is huge because I can't imagine being a child and thinking all I am is a victim. Um, yeah, so that's kind of the basics of trauma-focused cognitive behavior therapy, and the reason I'm interested in it is because it works with both the parents and the children. And I think too often the focus would be on the child, and then the parent can re-traumatize the child by not knowing what to say or how to act. So I think working with a parent is super important, and that's why I'm super interested in it. So a lot of people I talked to were like, why are you not interested in the EMDR if you're interested in trauma? Basically, it's just because I couldn't wrap my head around EMDR. In methods, we worked a lot on mindfulness activities and deep breathing and putting yourself in a different position and tapping and all that stuff. And I couldn't do it as a client, so I can't imagine doing it as a therapist. But I did find a really great article about EMDR and TFCBT, and are they both equally effective or not? And basically, what I found is like there's not really a statistically significant difference between the two. And this is from the Bison article I read that is up on the screen. But it did show that TFCBT and EMDR are better than usual care regarding clients with PTSD or trauma, and that TFCBT and EMDR are more effective than non-trauma focused cognitive behavioral therapy. So I thought that was super interesting. So I think they are both super good strategies or skills to have, but I am definitely more focused on the trauma focused cognitive behavioral therapy than EMDR. So I just thought I'd put that out there because I know people were really like, Corinne, you should do EMDR because that's what you're interested in or whatever, but not for me. Here's just some general information that I found on being just a trauma-informed counselor. So maybe not getting the certification, but continuing an education to be trauma-informed, because a lot of graduate programs don't have a big focus on trauma-informed counseling and trauma-informed care, and it's definitely something that as I've stressed over and over again, is super important. There needs to be better trauma-informed curriculum in graduate studies, so that moving forward, we are not going to re-traumatize our clients. One of my favorite quotes that I found while doing research in this class, I have down here in quotes, "To not ask about the elephant in the room leaves the client at great risk of being trampled by it." I think that's an awesome quote for trauma. If the therapist is not accurately trained on how to address trauma with the client, the trauma is going to beat the client down. It's going to trample the client. So that's why I think it's important to have just trauma-informed skills as a counselor. Having that freedom and acceptance to talk about trauma increases the client and the therapist's ability to learn from the experience and to get over the trauma. So my conclusion from all of this, though I do hope to get a trauma-focused CBT certification, is that possibly having a certification is not really the answer, but continuously gaining information will make you a better counselor, because just having those extra letters behind your name doesn't necessarily mean that you have the skills, but really investing into learning about how to treat a specific population or a specific thing is what's going to be more effective. So those are my references. I also wanted to talk about my interviews that I did. I had 3 really great interviews with 3 very different people. My favorite interview came from Darla Crum. She's actually not a currently active therapist, but she is an LISW, so not an LHC, but still did therapy and counseling. She had a lot of great things to say about counseling and licensure and certificate programs, and the future of the LMHC profession. She had a great take on certificate programs. Basically, her thoughts were that they were more of just a marketing tool. Just having those letters behind your name, it's a great way to get people through your door. But she said that's also kind of alarming or kind of an issue because if you just go to a training program to get those numbers or those letters behind your name and you don't really gain anything from the training, then you risk traumatizing your client or, not being an effective counselor. So her big thing was certification programs can be really useful, but they can also just be letters behind your name, just be a marketing scheme to get people to come to see you. He also pointed out that it can be extremely expensive and time-consuming to get different certifications, which can be really hard for someone who's working full-time, to make that time and have that money to get those certifications. So that's definitely something I didn't think about. I was just like, yeah, let's get certifications. So in general, she didn't see many benefits from having a certificate, other than the marketing aspect, which I totally see that now after speaking to her. So going on with that, she had really great advice for networking and getting referrals and having good mentorship. Saying that all those things are key to having a successful career. If you have a good supervisor or mentor, you can get opportunities to complete certificate programs for less. We discussed some of the major differences between going the LMHC route and the LISW route. And she had some great advice for those of us who are in the LMHC route, that we need to continuously fight and advocate for recognition for our profession, that we should be seen as equals to LISWs, but we're often not. And that the education between LMHCs and LISWs are equally valuable, but the licensure for LMHCs is not necessarily recognized. She feels that with the current political climate, we're at risk for that getting worse. So she really encouraged us all to really fight for our profession and for recognition and for licensure. And then went on to talk about retirement, and that she's not concerned about retirement at this time, but she does definitely recommend planning and saving up for retirement. She said one of the biggest perks of counseling that really she enjoys is that she feels she can do counseling well into her 70s and old age. So she doesn't have to retire super early because it's not a strenuous job in any way. I went on to talk to another LISW. It just seemed easier for me to find LISWs than LMHCs. Monica, who is a behavioral health consultant for a clinic, she had pretty similar views to Darla about certification programs. She says it's more important to find a population that you're passionate about to work with them. She works with HIV/AIDS patients in the LGBTQ population, which is why I was interested in talking with her, because those are both populations I'm super interested in. She says that for private practice, having certification programs are more important than if you're not going to do private practice. So if your plan is to do private practice, she does recommend it, but if you're going to work in like a community health center or clinic, it's not necessarily as important, which I thought was super interesting. She stressed more just continuing to gain education and always staying up to date on the current news and what's going on in the community is going to be super helpful as a counselor. The last person I interviewed was an LHC who works in private practice. She's basically where I'm at, like where I want to be in 5 to 7 years. She was a great person to interview. She is interested in getting EMDR certificate, but she doesn't have it yet. She's been doing a lot of research on it and the benefits of it. She did agree that it can be expensive and time-consuming to get those CEs and getting that final certificate, but she does see benefit to it. We discussed EMDR versus trauma-focused CBT, and she did agree that they're different, but they have similar outcomes. So it's just whatever you feel more comfortable with. One thing I asked her was about getting into private practice out of after completing licensure, and she assured that it's definitely possible and attainable. We went over the secondary data that we collected for the state, specifically the mental health data, and she was surprised by some of the numbers, especially mental health providers in Dallas County, because her clinic is in Dallas County, and she felt they had more counselors at her practice than they had for the whole county. So that kind of showed me that we can't always trust secondary data, and it may not always be accurate. So that was very eye-opening. However, when we were going over the rest of the data, though it was shocking and unfortunate, the lack of prescribers and counselors in some areas, it wasn't surprising. Liz feels like hopefully that'll grow and change over the next decade, and we'll get more mental health prescribers and more counselors in the smaller areas. And then Liz also agreed with Darla about planning for retirement. That is obviously very important, but that with counseling, it's something that she can see herself also doing into old age. So that was, pretty good to hear. So overall, I gained a lot from this class, and it was good to do the research, and I really appreciated the interviews and having time to sit down with counselors and talk about the future of the profession and certificate programs. Would I recommend certificate programs to other counselors in the field? I would say, yeah, like if you think it's going to help you see more clients, if you think it's something that you're interested in, I don't see why not. Personally, I'm erring more on the side of it is kind of a marketing thing to add some letters behind your name and get people into your door, but that's not necessarily a bad thing. I don't know if I will end up getting any certificate programs, though the trauma-focused cognitive behavioral therapy program does still have my interest, and I plan on continuing to do more research on it and hopefully getting it in the future. That's all I have. Thank you so much for watching.